Honoring who your loved one is, including what they like to wear, is still possible in memory care. Sometimes it just takes a little adapting. As dementia progresses, dressing becomes harder. Buttons are confusing, pulling something over your head becomes a battle, especially when there's limited range of motion. And for someone who can no longer communicate frustration clearly, that struggle often comes out as resistance or agitation. Here's what actually helps. Look up adaptive clothing. A quick search on Amazon or Google will turn up options designed specifically for this. Back opening sweaters, side snap pants, and adaptive gowns are all worth exploring. Back opening gowns are especially useful for people who are bedbound or anyone headed to the hospital. When the hospitals are overwhelmed and beds aren't available, I've seen patients sit in the ER holding area for days without ever being changed into a hospital gown, which makes hygienic care much harder to provide, especially if people are attached to equipment like IV poles. And if your loved one tends to undress themselves, look into anti-strip jumpsuits or adaptive onesies. You can modify what they already have too. If your loved one has a favorite t-shirt, you could consider cutting the back or the side of it and maybe adding Velcro or magnetic snaps to make it more wearable. I always recommend going up a size. Looser fits are easier to get on and off, reduce skin irritation, and feel more comfortable for someone who can no longer express that something is too tight. Choose the right fabrics. Soft, stretchy, breathable materials without rough seams are much better tolerated by someone with sensory sensitivity, which is common in dementia. For pants and underwear, elastic waistbands only. Avoid zippers, buttons, or snaps at the waist. For color and pattern choices, select solid colors or subtle patterns. Avoid busy prints or high contrast designs that can cause visual confusion or distress. The goal is preserving as much independence and dignity as possible, while making the daily routine easier for you and them. Hi, I'm Ashley, a nurse patient advocate with Caregiver Support and Resources. Give us a follow for more caregiver and dementia education.